Hi again, Dr. Rana. Yes, we do have some question like any alternatives for GMP visit, the site visit for by SFDA?
Sometimes when the SFDA require before when they request a site inspection visit, they request some documents. Sometimes when the documents are totally fine and they do not need any inspection, sometimes the manufacturing site is approved without inspection. It's according to
Okay,
the documents.
okay. And also there's a question like triclosan got an update to be considered as a cosmetic again
No,
ingredient.
triclosan is considered as a drug product, even if it's a cosmetic product.
Okay. Is it mandatory to submit products upon registration, upon registration on the SFDA?
In order to import them,
No. Once upon registration on the SFDA for the product, is it mandatory to submit along with the registration documents some products for the registered
yes,
reference?
for the
Yeah.
medical device, no. For the cosmetics products, no. But for the drug products, yes, they request samples
Okay.
to be sent, yes, with their certificate of analysis.
Okay. And regarding the certificate, can be renewed before its expiry or validity date?
Yes, the certificate for the drug products
Yeah.
is valid for 5 years.
Okay.
Before it expires by 6 months, you may submit for a new renewal request.
Okay. Okay, there's a question also like how do you differentiate between the medicated and non-medicated cosmetic? And is there any committee for it?
We differentiate between the medicated cosmetics and the regular cosmetics. The regular cosmetics is only a product used for protecting the body. It's for external use only, and it's for protecting the body, cleaning them. It's not for a physiological effect. If it has a physiological effect, then it's a medicated cosmetic.
Okay.
And if we are confused, if you cannot decide that this product is a drug or a medical device or cosmetics, you may submit a PCS application. It's an online system for the SFDA, sending them a request to classify the product.
Okay. Any questions you can ask, you can add your questions. Okay. So I think we need, thank you so much, Dr. Rana, for your informative presentation. And
Thank you so
now we
much. It's
can,
my
because there
pleasure.
are some questions for Dr. Salam actually. Dr. Salam, marhaba.
مرحبتين
Okay,
أهلا
we
وسهلا.
have some questions for you, please, like how we decide on the line for cosmetic to be imported by the Kurdistan Medical Control Agency for Trading Authority.
كان ممكن تعيدين السؤال? Can you repeat the
Okay,
question?
how we decide on the line for cosmetics to be imported by KMCA for Trading Authority.
They are asking about the line of production,
Line of cosmetic.
line of cosmetics.
Yes.
Actually, just when he's submitting, we are asking the applicant to submit his manufacturing as his manufacturer according to the certificate that he has. That it is impossible for the medical device manufacturer to submit for a cosmetic. Actually, we are asking him to submit his manufacturer with the required ISO certificate for cosmetics.
Yeah.
At that time, we're gonna give him the permission after the approval of each product alone as a cosmetic, and then he will get the import permission.
Okay, great. So I think you already answered the second question, but I will say it again. Is there special importation certification needed for cosmeceuticals?
No,
No. Okay.
no, actually.
Okay. Regarding Doctor, there is a question regarding the other areas in Iraq, the rest of the areas in Iraq. What are the terms of registration?
Actually, in other parts of Iraq, they don't have a registration process for the cosmetic manufacturers. They don't.
There's no regulation.
It is not regulated there, actually.
Okay, so yes, I think these are the question I have received
Just I
regarding
want to
those.
add one point, and because sometimes from the point that some of the cosmetic manufacturers they are producing a medicated product, it is not mandatory for them. They have a GMP for medicinal products. We are accepting to be produced in a cosmetic manufacturer, but all the criteria of a medicinal product should be available in the product. Should be approved in the national or the regional drug lists, and it will go through the medicinal processing line, actually.
Okay. Again, Dr. Rana, the same question is asked for KSA. Like what, like the special important certification needed for the cosmeceuticals importation in KSA? What are the certificates are needed? Dr. Rana, can you hear me? Ash is okay, Doctor. Okay. So now the question for medical device filler from European legal manufacturer. If without CE, is there any chance to proceed registration using the CE and the ISO from the contract manufacturer like China or Korea without reflecting its details in the final certificate? Yes, Dr. Salam, please. تفضل.
This is a question for me.
Yes.
Regarding the processing a manufacturer, if he has a CA certificate, but ISO
Yes.
from China.
Yeah.
Actually, the regulation is very clear that what is needed for a medical devices, that it should have one of two certificates, either the ISO 13485, which is issued from a certifying body already accredited from accreditation authority, a member of IAF.
Yeah.
That's what we are accepting. The other way that we put that if there is some manufacturer which have a GMP certificate for a medical devices also from reference countries, we can accept these certificate also. But otherwise, we can't accept other certificates actually.
Clear, thank you. دكتور عندنا كمان سؤال. Does Iraq regulates the advertisement for cosmeceuticals and medical devices?
عفوا ما صوتك ما كان واضح. ممكن
تعيدين؟ Does Iraq actually and KSA also regulates the advertisement for cosmetic and cosmeceuticals and medical devices? Do they allow them for advertisement?
Well, actually, they are doing advertisement. No, we are not regulating it till now. Actually, we didn't
What
get
about
this.
the case, Dr. Rana and KSA?
No, we have to register the flyers and brochures. It has to be registered.
Okay. Dr. Rana, صوتك, the voice is not clear. If you can repeat the answer, please, Dr. Rana.
For the products, the flyers has to be registered before being published.
Okay.
For the marketing materials.
Dr. Salam, also there's another question for you, please. But now Iraq, do they have manufacturer registration process called CO?
CO? No. In Iraq.
In Iraq, yes.
Actually, I'm not sure that they have something like that, but in Kurdistan, no, we don't have.
Okay. Okay, there's another question. Can the product be registered at the same time as both the drug and device? And what would be the implications if this happened? I think it can be like this question for both areas, please. Like in Iraq, Dr. Salam, like can the product can register in both, like as a drug and device and medical device?
No, actually.
No.
Meantime, we are registering only medicines. If medical devices are submitted for registration, we are not registering medical devices. Actually, we are only registering medicines now.
Okay, and Dr. Rana, for the SFDA?
No, if it's a product that contains a substance that it's only classified as drug, it will be registered as drug only. It cannot be registered as medical device too.
Mm-hmm. Okay. Dr. Salam, for registering the manufacturer with the KMCA. Some of the requirements mentioned in the KMCA from form are uncommon, such as the number of the staff and the square foot size of the manufacturing site. Can you kindly clarify this point?
Actually, just we are asking about the number of the cells available in every part, but because this form of registration has been designed to be simply like a substitute for the site inspection. Actually, just we want to get a view about what is the size of this manufacturing, what is the capabilities that can be available, and to just an information, but it should be present inside the register form. It should be mentioned.
Okay. Thank you, Dr. Salam. Now the question for Dr. Rana is someone want to ask about the beauty products, particularly the contact lenses. Do they have a different treatment since they can be even for site correction or for coloring, like beautification?
No, the one only for color, the non-prescription is classified as medical device. This is the one for beauty. It's classified as medical device.
Even the one for colors, it's classified as a medical device without any power device. For the patient, right?
Yes, exactly.
Yes.
It's not registered as cosmetics, yes.
Okay. And another question, okay, because your voice, okay. So Doctor, another question for KSA, can someone want to know which authority in KSA for the advertisement? Is it FDA, the one that will give the approvals?
Yes, exactly. It's the SFDA, yes. And sometimes for the medical device products, it's through their website, through the medical device system registration website.
Okay. So I think I'm done with the questions. I'll be happy to receive more questions for Dr. Rana and Dr. Salam. So, okay. So if you want to add any more points, Dr. Rana or Dr. Salam, you feel free, please, before we end the session. So if you want to highlight some points.
No, thank you so much. Thank you so much.
Thank you very much.
Pleasure.
Okay. So now, thank you, Dr. Rana and Dr. Salam. It was my pleasure to have you today on ACRAS, and hope to see you again very soon. And thank you, ACRAS team, for this such amazing event and hearing the new regulations and the updates also in the regulatory affairs. Thank you so much for you, Doctor.
Thank you very much.
Thank you so much. Thank you very much.
Bye.